Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad, Masters in Orthopedic. Today we are going to discuss about the knee joint pain in the teenagers. Usually in children as well as the adolescents, the children do not complain to the parents when there is fall due to playground or anywhere in any activities. Following that, the child develops the hemarthrosis, that is the blood in the joint, leads to infection, that is otherwise commonly called as septic arthritis. So this is the common feature, we see it in children as well as the teenager, leads to joint pains. So apart from this, there is a possibility of juvenile rheumatoid arthritis. Due to immunological disorders, they develop this disease and the arthritis. So the otherwise there is a trivial injuries leads to certain times the ligamentous injury, that is ACL or PCL or the collateral ligaments, and the meniscal injuries. These are the very important parts of the knee joint which leads to damage to the entire joint. So apart from this, in children, in teenagers, due to road traffic accidents or due to their sports activities and then their day-to-day activities leads to the damage to the joints due to fall or due to road traffic accidents. Following that, we see multiple fractures in the joint, intra-articular fractures which damages the joint more than the normal fracture, which affects the entire joints, leads to arthritis. Then there is a possibility of reactive arthritis due to infection. The following infection in the bone, muscles, tendons, skin happens to be affect the surrounding joint, leads to the synovitis or reactionary edema or reactionary arthritis to the joint. Apart from this, what we see in the children or the teenagers, they due to routine activities where there is a possibility of immunological disorder or septic disorders or infective disorder or could be viral disorder, leads to a non-specific arthritis in the multiple joints. So these are the joints affected in the adolescent, teenagers and the children. So these are the very important investigation we need to do, like X-rays, CT, MRI as well as the certain blood tests to rule out the cause. So here what we find is due to the infection, then is it a bacterial infection or is it a viral infection? Sometimes very rare fungal infection also causes the arthritis. So specifically we have to rule out with a certain blood test and then diagnosis and treat accordingly. So what exactly we need to rule out in the specific arthritis pain, where when there is an immunological disorder, specifically whether because of the rheumatoid arthritis and the juvenile or children's leads to adolescent arthritis and the teenager arthritis. So those are specifically need to immunological therapy to treat the patient.